Well, hey everybody, thanks for joining today. I'm your general contractor and host, Mike Krupa. Today's the final episode of this webinar series, episode 6, and I'm personally very excited because today we're going to dig into the case study of an employer who implemented everything that we talked about during the first 5 episodes. And if you missed any of those, you should have got a replay. Go back and check those out. And as always, feel free to type in any questions you have. You could type those in now or during the presentation. You know, we have about 45 minutes today. I'm confident we'll end in probably 30, and then I'll leave some additional time to answer any questions, but feel free to type those in. And with that, I'm going to go ahead and just dive right in. You know, for most employers today, this is what your health plan looks like, right? It's outdated. There's design flaws. You've seen this before. Design flaws that need to be fixed. Employees don't like it. And that was my bathroom a couple of years ago, original to our house. Design flaws led to a leaking shower, was starting to cause damage in other areas in the house, and me and my wife absolutely hated being in here. And this was the case for this employer that we're going to talk about as well. This is an Illinois manufacturing employer that had about, and still does, has about 90 employees enrolled on their health plan. And so I'm going to talk a little bit about the journey of this employer as a client of ours as well. So we actually met this employer in 2017, and it was clear that they were not getting any new ideas from their current broker. They'd been with every fully insured carrier over the years, Blue Cross, United, Aetna, Cigna. Some of them they had been with more than once. And we brought some new ideas to them. They had terrible health plans. They had $6,000 deductible health plans. Like this, they had premium increases they had been passing along to their employees. It just, things were not working. We brought new ideas to the table, but they were facing something a little bit bigger that I think most employers are facing today. And that's a fear of change. Fear of change from one, their current broker, and two, doing some things differently. But, you know, they loved the ideas. We had built a really good rapport with this employer, but their broker did their business insurance, they did their 401k insurance, and they handled their benefits. And this employer was afraid that if they moved their benefits, that the other lines of business that they had with this broker were going to suffer. So they actually didn't hire us. But we kept in touch with this employer, and we got the opportunity to meet in front of them again in 2018. And it was clear nothing had improved with their existing broker. We continued to bring them some new ideas, and then through this process, they got slammed with a renewal. They got a 32% renewal from their existing carrier, and no options from their broker. And so we got the opportunity to scour the market, and we found a much better option for them for that year. Was still fully insured, and because of this, they ended up hiring us. And so we started educating this employer on why they were having some of these insurance problems within their health plan. And for those of you that have been along for the journey, you've definitely seen this, but just to reiterate, this is exactly what we started educating the employer on, is that the healthcare system was stacked against them. That's why they were getting the results that they were getting. You know, they have major insurance carriers in place over the years. And, you know, as you know from previous webinars, when Obamacare was passed, there was an incentive in there called the medical loss ratio, or a portion called the medical loss ratio that really incented carriers to increase the costs of services. And we've seen that happen over the last 13 years since it's been in place. And the only people that are benefiting from this are the insurance carriers. Employers are not seeing better health plans. Employees, patients, utilizers, were not seeing better results, but the insurance carriers were and are. And then you have this PPO network, and tons of choice in a PPO network, right? Which is great for a member on the surface, but we don't have good quality tools or cost tools to determine upfront if we're going to a good quality provider. And that's a problem in a PPO network. And because of that, you get this huge disparity in prices, right? The same exact procedure here, 10 different prices from $1,000 to $6,000. So these are types of things that we have to combat if we're going to start to remodel a health plan. And then the last is these spending limits, right? You have this medical ID card that all of your employees get, but the fact is they can go to any provider they want, regardless of cost and quality, and you as the employer are picking up the tab at the end of the day. Whether you're self-funded or you're fully insured, eventually that is going to hit your health plan. And so they now started to understand the problems that they were having, and so it was a lot easier to talk through solutions with them, and specifically the process that we put them through, which is this remodel health plans process you've all seen now, and it's 3 steps. It's control, it's align with partners that have your best interests in mind, and it's reward your employees. And what I'm going to do today is I'm going to do a deep dive into each one of these steps and show you what this employer did in each one of these steps to get the results that they got. And these are the financial results. I'm going to show more than this, and specifically some utilization. But let's just start with this, right? In 2021, this employer was spending about $1.1 million on their total healthcare spend. Now, mind you, this is we've had this client for 3 years. They've been fully insured. $1.1 million in this year, and we get their renewal. And it's a 35% increase, and there's no competitive options on the table. And this is one of those cases where the existing insurance carrier, they weren't willing to negotiate at all. 35% was it. That's what they came with out the gate, and they were not moving at all. And this is where employers are eventually going to hit. They couldn't take this path. It wasn't an option for them. They were already getting squeezed by their suppliers, and so absorbing that kind of cost increase, almost $400,000, was not an option for them. And they knew they had to do something different. And for this employer, they had to make a decision. They were forced to really remodel their health plan all at once, which is not the typical path employers take when they go through this process. But they had to, because of this increase that they were facing. They had no other choice, right? If your bathroom in your house is falling apart and causing damage into other areas of your home, you're going to address that. You're going to fix it. And that's what they did here, you know. And I'll say, right, it took them a while to get here, but when they ultimately decided to remodel their health plan, they ended the year at 8% over their previous year's cost. 35% is what they were facing, or almost a $400,000 increase, and they were able to reduce that significantly, almost $300,000. And that's on top of some of the enhancements that they made within their plan. And this is what is possible for employers when you go through this type of process. It took years of planning for this employer, right? And I don't want to discount that, because the whole remodel health plans process, it starts with control. And they initiated establishing control by hiring a new broker, right? We created a multi-year strategy for this client, and then we started to collect data that was available from the existing insurance carriers. And like, this is something I want to stress with the remodel health plans process that I run into often with employers, is that they associate this entire process with self-funding their health plan, right? And that's scary to a lot of employers. And I want to stress that That may be an ultimate destination if you see this process all the way through to the end, but not every employer may ever even go self-funding. You can do a lot just within this first phase of the process. And this employer did just that. You have to start thinking in multiple years, though. I can't stress that enough in this series, is that's the key, right? You got to align yourself with the right broker, but you have to start thinking in multiple years if you want different results. And this employer, they implemented the Remodel Health Plans process. They stayed fully insured for 3 years, but they set a multi-year strategy before they got to year 4, when they ultimately got the ultimate control of their health plan by going self-funded, right? And they had to. But what this allowed them to do was the next 2 steps in the process, which is align their health plan with partners that had their best interests in mind, and to reward their employees for making good healthcare decisions. And so year 4 comes in, we completely remodeled their health plan. Let's talk about some of the partners that we align them with, partners that we've talked to throughout this webinar series. They hired the broker initially, right? That's where things definitely started to change. And now we move into a self-funded health plan after 3 years of being fully insured. I should say within those 3 years, they switched insurance carriers a couple more times as well. But what we did with this employer was we moved them to an independent third-party administrator, or a TPA. And what I mean by independent is a TPA that's not associated with one of the major medical carriers. You know, United Healthcare owns their own third-party administrator, UMR. Aetna owns their own, Meritain. We're saying somebody totally different from that, right? Completely independent, removes conflicts of interest. That's where we started, and we included the same thing on the pharmacy benefit manager side with Drexy. You know, a pharmacy benefit manager, we know exactly how they get paid. We know exactly what they're incented to do, which is just do their job. And what this allowed us to do was simultaneously implement some cost containment programs that actually had a positive member impact. Too often I see cost containment programs that are just a complete negative. We're talking about solutions that actually have a positive impact on members' pocketbooks at the end of the day. So we did that. We implemented a medical management vendor called AIM that allowed us to steer members to high-quality providers. They're utilizing tools that us as consumers, we don't have access to, too expensive, but there are tools out there that provide quality information and really good quality information. And so now we're able to tell somebody that before they go get their knee replacement, hey, do you want it from somebody that has a 20% quality rating score, or you could go over here and they have a 90%. Who would you rather get operated on? So we implemented that, and then we added spending limits on the unlimited company credit card by implementing ClaimDoc, or a reference-based pricing partner. That allowed us to set an upper limit on a threshold. We were now getting every single hospital bill audited. We were making sure that we had a fair and reasonable price on the cost of services. We wrapped this all with a really good stop-loss carrier. This is AccuRisk. And what we did with AccuRisk was we leveraged all these different competitive cost containment solutions, and we were able to secure a much better stop-loss quote because of that, almost 20% lower than it would have been. But then there was the secret sauce that we implemented, and I'm going to talk about that. This was a key partner in this process that allowed a very, very positive member experience. And remember, you got to love the health plan. You got to love the bathroom at the end of the day. If the customer doesn't love it, nothing else matters. And that's what this partner, ImagineMD, allowed us to do. And you heard from ImagineMD twice, right? They're a direct primary care partner. And all that means is that we now purchase primary care like a gym membership. We pay a monthly membership fee for it instead of every time we go into the doctor. And that's the secret sauce, because what it allows the direct primary care partners to do is cut out a ton of administrative waste. And now they have a known revenue stream that they're getting. So because of that, they're able to reduce their patient panel to a quarter of the minimum of what a traditional primary care provider sees. A traditional primary care provider sees a minimum of 2,400 patients a year. These primary care partners, and there's more than just ImagineMD out there, these primary care partners are doing something different. They're capping their patient panel at 600. That right there is the secret sauce, because it leads to more time with patients. You know, today what happens is it takes you 4 weeks to go get into the doctor's office, and you probably get 5 to 15 minutes with your doctor, and they've probably given you a script or sent you to a specialist, because that's all the time that they have. Not to their own fault, but that's just what the system has perpetuated now. And so when you give patients this additional time, you can take care of 90% of their healthcare needs. You get hour visits. You get initial 2-hour visits for a complete family history download. And every time you go in, it's free to the member. 1-hour visits, unlimited, as many times as you want through the year. And by doing this, it allowed us to maximize and create a better experience for all these different solutions that we put within the health plan. You know, we removed a PPO network. We implemented reference-based pricing, which can have its warts, but we mitigated almost completely all the noise that you would see in a reference-based pricing environment, because this primary care provider, they knew who was friendly and who wasn't. And there's plenty of options in the Midwest to send people to in terms of providers. And so they were sending people up front to the right providers, because who do we trust as consumers of healthcare? We trust our primary care physician. So we were sending them to the right place. They have a generic first policy, which you'd think would be a standard these days, but isn't always. So they're prescribing generics first if there is one available. And then, you know, we have these different point solutions within the health plan. We got some things on the prescription drugs. We got steerage to high quality providers, and they know about these. We educate them on all these different solutions. They have a copy of the plan design. They know when a member needs something that there's these point solutions, and they maximize the results that we get out of those point solutions. And that's really what helped get the savings and get a positive member experience. And this is what I'm really excited to share with you, is the utilization results. You saw the financial results. This is why we got the financial results. Here's what we saw. When we compared folks that were in the direct primary care plan to the non-direct primary care plan, we had about 60 people that were in the direct primary care plan in Illinois. And then outside of Illinois, everybody was just in a plan like with a traditional primary care physician. When we compared the results of those two, we saw a 73% reduction in the amount of ER visits that people had in the direct primary care plan. We saw a 28% reduction in the amount of urgent care visits. We saw a 85% reduction in the amount of visits when people were actually admitted to the hospital. A 94% reduction in labs and x-rays. Like labs, x-rays, these are the kinds of things that are just completely abused. Doctors these days just do test after test after test, but not all those tests are needed. And you know, a lot of the times that doesn't have a consequence, but you know, sometimes it does when you're getting maybe a CT scan to the brain that you don't need, right? You're exposed to radiation. And labs are one of the easiest things to abuse. So 94% reduction in the amount of labs people were getting. This one is my favorite here. 40% reduction in the amount of prescriptions that were prescribed by a physician. Like, let that sink in for a second. That is a huge number. And this isn't a number that we're seeing just on one client. Like, these are stats that we're seeing on all clients that are implementing these types of plans. But let me talk about this for a second, right? Like, when you don't have time with your primary care physician, you know, what did I say happened, right? They have time to basically write you a prescription or send you to a specialist. When you have time, they're not writing as many prescriptions. They're not sending you to as many specialists. You're not going to the urgent care anymore because you have a doctor 24/7 that you can call. All of these things, including a 7% reduction in specialist visits, all of these things are things that reduce costs over time. And why go into the doctor if you don't have to? You know, these days we don't have time to do that kind of thing. So these were just absolutely amazing results from this one partner that was able to bring everything together. And these are the kind of results, I got to say, that are completely repeatable for employers out there. And that's why I'm excited, because we can do this over and over again for any employer that wants to go down this route. Here were just like a handful of success stories that we saw that, again, all have, you know, a direct impact on either cost or member experience. Out of somebody's initial visit who's pretty high up at this employer, send them to the ER right away. They had an initial 2-hour appointment, and within that 2-hour appointment, they uncovered a 10-year unidentified issue. They literally sent that patient directly to the emergency room. Now that issue is solved and stable. This is the kind of thing that doesn't happen today, right? Another one, they diverted a patient who was on their way to the ER, called their doctor, their emergency line on the way to the ER, and diverted them to their own clinic because it wasn't really an emergency, right? That happens a lot of times. A lot of times we go to the emergency room and it turns out not to be an emergency, and vice versa happens. We don't go, and you know, we probably should have. There actually was an emergency going on. On top of that, they work directly with the reference-based pricing partner. And there was actually a patient that wanted to see a specialist that, you know, we knew didn't play well in a reference-based pricing environment, but we were able to work together with ImagineMD and ClaimDoc, the reference-based pricing partner, to work out like a single case agreement to get this person to see this specialist that they needed to see. And then finally, arranged high quality knee surgeons for two knee replacements. So often I've seen people getting knee replacements or joint replacements, and they're going to a doctor that has a terrible quality rating, and they have a terrible outcome. You get them to the right doctor up front, which, believe it or not, can end up being the lowest cost provider. The plan saves money, but the best part is that the member gets it done right the first time, and they don't have to get it redone. Now, you've heard me talk about reward and how important this step is in the process. This is where, in my personal opinion, most brokers fall down. They implement all these cost containment solutions, and the result is a terrible member experience. Well, that does no good. You have to have the people that are utilizing the health plan love it. And so here's what that employer did to get those results. First, and I don't want to downplay this, they improved their plan designs by 10%. So think about that. Where most employers are increasing deductibles and increasing out-of-pockets, they did the opposite with this change. That change right there they basically ate $120,000 worth of costs by making those plan designs better. And they still had the financial results I showed on the previous page. So all of the design changes that we made collectively, including reducing deductibles by $3,000, virtually we eliminated HSA plans and added copays on all prescription drugs so people didn't have barriers to care or getting what they needed. All that was worth 10%. It was huge. And then they reduced their employee contributions for people that took the primary care plan, the direct primary care plan, by 60%. On top of that, because it was direct primary care, they got free unlimited primary care. The medical management vendor, AIM, we had an incentive built in place. So for those people that went to high quality knee surgeons, those two people, that was free for them. We reward people for making good decisions. Their cost share was completely waived when they went to see those knee providers and get their knees replaced. Huge. And then on medications, we offered a lot of free opportunities. We had one member that was getting a $13,000 medication that we were able to reduce that in half and give them that drug for free. So people with the highest cost meds that used to have barriers to care because it was an HSA plan, now they're getting opportunities to get their medications for free, and the plan is saving on the back end. And that's right. I think this is the biggest thing I've probably stressed throughout this series is that, like, this is the magic, right? Aligning your health plan with the right partners is key, but like getting people to actually change their behavior, you can do it, and you can do it by free because there's a ton of waste in the healthcare system. And this is the final result. You've seen some pictures of my bathroom. Here's a couple more. My wife would kill me if I put my son's picture in public out here, so I blurred out his face, but this is it. This is the final product. I had a customer in mind, and it was my wife, and she loves the bathroom. I love the bathroom. Years later, as we go in there, and that is so important to us. And make sure that if you go down this process, you have your members in mind, because there are so many ways you can reward them for making the right decisions. It's almost 11:30 here, right? My call to action, and we're going to get to questions because I am seeing one here. But my call to action to the employers on the phone today is just have a conversation. Let's just talk about your health plan. I'll tell you something about me. I used to remodel homes for a living. That was my job. I fell into actuarial science. Most people fall into insurance. I fell into it. And then I stayed on the analytical side for basically 18 years of my career before I became a benefits advisor and started looking for new employers to do this with because I saw how effective it was. I tell you all that to tell you, I'm not your typical salesperson. I'm not somebody that's going to sit here and try to convince you to do something that you don't want to do or you're not ready to do. But a conversation is just a conversation. And I would encourage you on the phone, let's just start there. Let's start by having a conversation. And if you think you're ready to do that, let's do it. 30 minutes. That's all it'll take. Where we go from there is totally up to you. And so, that's it. I want to thank everybody that stuck around for these 6 episodes. I appreciate the time that you have invested into this series. My only goal and hope is that you got some value out of this. I truly am trying to change the healthcare landscape here in this country and in the state of Illinois. And I appreciate the fact that you listened in here. And so let's get to some questions. Let me just see here what we got. All right, I do have one question that came in. Oh, this is a good one. What were the results in year 2 for this specific employer? Absolutely great question. So this employer in year 2, let me highlight a couple of things here. First, let's talk about the financial results first. They had a 5% increase for the next year. So they're still spending well below where they would have spent with their 35% fully insured renewal that they declined, right? They're still spending about 10% lower right now. So a 5% increase the next year, which is fantastic. One of the most notable things that I think is important here is what happened with the direct primary care plan, though. So we had about 60 people that could take that plan in the state of Illinois, because that's where that direct primary care clinic was. And I think first year we had about 55 people of the 60 take it. So almost everybody took it. Not a single person in year 2 that took that plan left that plan. Every single person that had elected the direct primary care plan stayed in it. And that's powerful. They all had to switch their doctor when they moved to that plan, right? That was part of the deal. If you move into a plan like this, you have a choice of, doctors at different locations, and those are the ones that you choose. Everybody elected to change their primary care physician. They had a positive enough experience, and they stayed. And we actually got, if we had 56 the first year out of 60, we got 2 more over that migrated. There's only 2 people left in that other plan there. The other 30 are out of state. They're in a different plan. And so just like amazing there. And then keep this in mind. No plan design changes year 2. No premium increases for employees year 2. They were so happy with the results that they kept everything the same. How many employers can say that they didn't switch carriers, that they didn't have to pass along an increase to their employees, they didn't have to implement a worse plan design to try to be able to absorb the cost increases? So that's the kind of results that they had in year 2. And now what we're doing with this employer is analyzing the massive amount of data that we have, because they're in a self-funded plan, and we're continuing to implement solutions that are impacting members. And so that's the next phase of their multi-year strategy. The strategy doesn't end. We continue to look at that data and match up solutions that are going to make a better member experience and save the employer money at the end of the day. So sorry, that was a long-winded answer to your question, but there was a lot of good things that happened in year 2. Let me just see if we have any other questions. You know what? It looks like that is it. So again, to the audience, just want to thank you for joining me throughout this journey. This QR code will take you straight to my calendar. I challenge you to have a conversation with me.